Ramsay Hunt syndrome. What is this disease? Justin Bieber has just announced to his followers that he has a facial paralysis due to Ramsay Hunt syndrome. Will he be able to continue his professional career in the future with this disease? Justin Bieber has recently announced on his social networks that he's suffering from a strange peripheral facial paralysis, which has been diagnosed as Ramsay Hunt syndrome. This pathology has forced the young singer to suspend his upcoming concerts. Find out all about Justin Bieber's Ramsay Hunt syndrome diagnosis in this video. This disease is viral and is caused by the same virus that generates chickenpox and shingles. It's capable of altering people's quality of life, even involves changing daily and work routines. In this video, we'll explain how the disease is contracted, its most obvious symptoms, and if there's any treatment. How does one get Ramsay Hunt syndrome? It's actually a reactivation of the varicella zoster virus that is lodged in a cranial nerve. The natural history of this disease is that the patient is exposed to the virus, usually in childhood, and may or may not have the typical chickenpox. The viral agent isn't eliminated from the body and lodges in some neurons to remain in a latent state. Over the years, it's possible for the virus to reactivate. However, the person can also grow old without knowing anything about it. The varicella zoster virus can reactivate in the form of herpes zoster, which is more common than Ramsay Hunt syndrome. It happens when the lodging of the viral agent was in an intercostal nerve. When reactivated in this mode, it causes the well-known shingles. There are vesicles and blisters on the thorax with a sensation of burning pain and high skin sensitivity in the region. In Ramsay Hunt syndrome, the lodging of the virus is in a nerve of the face or skull. Therefore, the symptoms are different from those of shingles. Herpes zoster virus. The varicella zoster virus can lie dormant in the nerves of the body to reactivate in the future. Why does the virus reactivate? The virus doesn't reactivate in everyone who had chickenpox as a child. As we have already mentioned, many people go their whole life without hearing about it again. The case of Justin Bieber's Ramsay Hunt syndrome is somewhat rare because of his age. As far as we know from scientific studies, being over 60 years old is a risk factor for reactivation, and it's less frequent in young people. We can assume that reactivation of the varicella zoster virus is due to a drop in defenses. That is, the immune system is weakened for some reason and the viral agent takes the opportunity to manifest itself and replicate in the nerve where it was lodged. The immune system can be compromised for various reasons. A severe underlying disease that forces the body to direct resources there. The consumption of drugs that affect white blood cells and immunoglobulin production, such as corticosteroids, for example. States of stress, anguish or nervousness that increase the secretion of cortisol and by this means inhibit the usual action of white blood cells. What are the symptoms of the disease? Most patients with Ramsay Hunt syndrome have vesicles and blisters on the face, near the ears and eyes. Some people develop peripheral facial paralysis with difficulty mobilizing one side of the face. Other symptoms that may appear are as follows: pain in the face, tinnitus, a sound of unknown origin only perceived by the patient, hyperacusis, momentary loss of hearing, alteration of the sense of taste, dizziness and vertigo, facial paralysis. Can Ramsay Hunt syndrome be treated? Research reveals that treatment for Ramsay Hunt syndrome is supportive. This means that there is no cure to eliminate the virus completely from the body. Doctors can prescribe acyclovir, which is an antiviral that reduces the length of time the symptoms last. However, it must be administered early for it to be effective. For associated symptoms, there are specific medications. For example, if the patient is in pain, Carbamazepine, an antidepressant with a neuroanalgesic effect, may be prescribed. It's common to supplement with vitamin B12 at the same time to promote neuronal recovery. Dizziness and vertigo are also treated with anti-vertiginous drugs, and ocular lubricants are recommended for the eye on the affected side, as the lack of blinking can cause dryness and corneal damage. The time of evolution is variable. We don't know how many weeks people will suffer from the symptomatic expressions of Ramsay-Hunt syndrome. It's estimated that the average time is 3 to 4 weeks until remission. However, there are cases that last for months until complete recovery is achieved. Thank you for watching. Don't forget to like, comment and subscribe. Comment